It will cause a lot of pain, which is what I've been experiencing for the past 3 months. After some time, I also actually felt this sensation. I don't think it's been talked about on Reddit or Xiaohongshu. So actually this thing blindsided me at the time, but I was very devastated that day. It was a constant pain of 1 to 2 out of 10, and I just felt like I didn't want to live like this. I think I'm somebody who, if I Google and the symptoms don't completely match, I will be in denial and think that, you know what, maybe I don't have this, maybe I don't need surgery. Hi guys, my name is Chai Yi. Welcome back to my channel. So this video is basically going to be an update about a health condition that I've been experiencing for this past 3 months, which is being diagnosed with an anal fistula. And the reason why I'm making this video is because I see a lot of posts on Reddit or apps like Xiaohongshu with people talking about this medical condition, but I've never actually seen a lot of videos on this on YouTube. So I thought that I just wanted to make a video like this so that it might help someone out there who is experiencing a similar situation know that they're not alone. And yeah, without further ado, let's get on with the video. And the first thing that I want to talk about is what exactly is this condition, in case somebody clicks onto this video and they don't really know what it is. So according to an article from Cleveland Clinic, an anal fistula is usually a side effect of an anal abscess, an infected wound that drains pus from your anus. The draining abscess can create a tunnel through your anus to the skin outside. Anal pain, swelling, and redness are the primary symptoms, and surgery is the primary treatment. So to put this in simple layman terms, a fistula is basically a tunnel or tract that forms after you get something called a perianal abscess. And this tunnel connects your anus or rectum towards the skin around your anus. So what will happen is, because the rectum is a place where poop and everything passes through and there's a lot of bacteria, so if you have this tunnel, which you're not, normal people are not supposed to have, dirty things will go through that tunnel and cause infections around your anus area, and that's where you will feel swelling and everything, and it will cause a lot of pain, which is what I've been experiencing for the past 3 months. And now I would also like to share the process of how I got my diagnosis, because I feel like everybody experiences different symptoms, and I think one of the hard things about this is that sometimes your symptoms are not even very obvious, and even when you go to the specialist, everybody will have different opinions, and sometimes even the doctors won't be too sure what problem you have. And I hope by sharing my symptoms, anybody watching this video would know that, oh okay, maybe I do have this, and maybe I can bring this up and explain this to my surgeon. Because for me, my symptoms were not really exactly the same as the symptoms that people would normally expect, and so my diagnosis story was also not very straightforward. And the common symptoms for most people are pain around the anal region, swelling, and pus either draining from the skin around the anus or at the anus. So to start this story, I'm going to give a background of my medical condition. So back in January this year, I actually got a perianal abscess. I went to the ER, got it drained, and so that treatment is called incision and drainage. So everything was fine for 6 months until about July, when I saw a boil, which is a bit like a pimple, or in Chinese we call it a 水泡, forming at my wound area, and it's at the exact same place where the wound for my perianal abscess surgery was. So this is what you would call an abscess recurring, and even though this time the abscess wasn't as serious as my abscess back in January, I think it usually means 2 things. If an abscess occurs at the same spot, it's either an abscess recurring, meaning that it's simply just an abscess forming again on the same spot, or you might have what I've been talking about just now, which is an anal fistula, because you have a tunnel connecting your anus or rectum to the skin where your abscess was first drained, and so you have repeated infections at the same spot. So these are the prime 2 suspects, and at first I wanted to write it off as just simply a 水泡 happening at my wound site, but I wanted to be safe, and so I saw my specialist I think 2 days later, because the day it happened was a Saturday night and Sunday the specialist clinics weren't open. So before I even got to see my doctor, the abscess popped, and when I saw my doctor, it was honestly a very stressful day for me at that time, because I didn't know a fistula would actually form after you got your abscess drained. So actually this thing blindsided me at that time, but I was very devastated that day when the doctor told me that, oh, if your abscess forms at the same spot, it's very highly likely it's a fistula. And so at that point, my doctor told me this, but he also told me that he would recommend me to get a second opinion, because for him, I think he only does the more traditional surgery methods, which involves a lot of cutting, and so he asked me to go for a second opinion. And this is where the next phase of my story starts, which is actually the most stressful part of this entire fistula surgery journey, which is trying to find a doctor. Because at the time, I remember when I was first told that I might have a fistula, I was really worried and I don't know what this means for me, because I've read online that fistulas are really hard to treat. They require multiple surgeries, and even if you've done multiple surgeries, it might still recur over and over again. So honestly, at the time, I was really scared, not gonna lie. So after asking around, I managed to get a colorectal surgeon to consult, which is about a week after this abscess first happened. And upon clinically examining me, when I say clinically examining, it basically him like pressing around my butt to examine that area. And after clinical examining me, he says that I probably do have a fistula, but the thing is, like, he wasn't sure whether there are any branches or anything. So what he did was he ordered an MRI scan for me and also recommended me to another surgeon in his clinic who was more specialized in doing fistulas. So I had my MRI done 3 days after that appointment, which was about 1.5 weeks after the abscess just recurred. And after that, I think after MRI scan, another 3 more days, I saw the second colorectal surgeon. So by the time I saw the second colorectal surgeon, it was 2 weeks after my abscess recurred. And the weird thing during that appointment is that the MRI report actually showed that I have no fistula, meaning the radiologist thinks I don't have a fistula. However, she reported that there is a sinus tract along like my butt region over there. And so the doctor also felt that, okay, since the radiologist thinks that I don't have a fistula and he doesn't see it from the images as well, he thought that maybe I was healing and just told me to perhaps I can just observe it first. Because upon clinically examining me at that time, all my swelling had went down. Because I think prior to the MRI, where I was also doing dressings at my old hospital and also having antibiotics, and so the MRI scan didn't show anything, and so the doctor said that, you know what, you can just wait and see if it actually has healed up on its own. I was cautiously optimistic after that appointment, and so I went home. But during that week after I went home, I realized that my wound site was swelling again, and I was feeling more and more pain as each day passed. And I realized that, you know what, I think healing doesn't feel like this, because I've experienced that abscess before back in January, and I know that healing normally doesn't feel like this. And so I made an appointment with that doctor again and went to see him. By the time I saw him, it was 1 week after my last appointment with him, so by this time it's already 3 weeks after the abscess first recurred. And he also felt like, yeah, it is actually getting a bit more swollen compared to last time. And so his suggestion at the time was to do another MRI. And that's why I say my symptoms were not really like how a regular person having a fistula would be. I was having no pus drainage, even from my anus or from my wound site, which is the external opening. I also didn't have a lot of redness. The only main thing I had was swelling, and after some time, I also actually felt this sensation. I don't think it's been talked about on Reddit or Xiaohongshu, but I would actually feel an emptying sensation at my butt. It's like as if there is fluid emptying from my butt. I know this is TMI, but I'm really just trying to be very helpful to anybody who clicked into this video. And so even the doctor couldn't say for sure whether there's a fistula, but what he recommended at my stage was to just do another MRI. And so I did the other MRI, and lo and behold, I actually did have a fistula. So the MRI was 3 days after that appointment with him as well. So by the time I got diagnosed with a fistula, it's about 1 month after it first recurred. And so the MRI report showed that I have a transsphinteric fistula. I hope I'm pronouncing that correctly. It basically just means that my fistula tract passes through the internal and external sphincter, meaning it involves quite a bit of muscle around your anus. I'm sure somebody who has a fistula already knows, but if you're watching this video and you don't have any idea about fistulas, basically there's also many different types of fistulas. Some fistulas pass through a little bit of the muscle around the anus, but some passes through a lot. So in my case, it passed through quite a bit of the muscles around my anus, and so I wasn't a good candidate to do procedures like fistulotomy, because even though fistulotomy has a very high success rate and most people do fistulotomy, I couldn't do that because I would suffer from bowel incontinence if I were to do that sort of procedure. And so I had to do what they call sphincter sparing procedures, which is procedures that don't require cutting of the muscle over there. So the main takeaway I would want anybody listening to my diagnosis story is to know that not everybody's symptoms are exactly the same. Because honestly, if I didn't see a doctor and just diagnose myself through Google, I don't think I would have like been able to solve my problem, because I think I'm somebody who, if I Google and the symptoms don't completely match, I will be in denial and think that, you know what, maybe I don't have this, maybe I don't need surgery, you know. But the thing is that I think everybody's symptoms are different, and so if you feel discomfort and it's not something that you can just, like, the pain is not something that you can just ignore, definitely go see a doctor. And also, if you continuously, even if a doctor says that you seem fine but you still don't feel fine, then like advocate for yourself, which is what people on Reddit always say, advocate for yourself, meaning like just, if one doctor doesn't like take you seriously, just find the next doctor who you can get a second opinion from, who you can confirm whether you are okay. So yeah, this is the main takeaway I want anybody who's watching my video at this segment to know. And after being diagnosed with this transsphinteric fistula, the next thing was actually finding a doctor. And to me, this wasn't a very straightforward process as well, because in my mind, I've already read so many articles, and I know that if you have a more complex case, like for me, a transsphinteric fistula where it involves more muscle and the surgery procedure is more complex and not so straightforward, the surgeon's skills would also matter as well, in my opinion, because you don't want a situation where you jump into surgery and the surgery wasn't done properly, and because of that, the surgery fails and you have to do the surgery over again. So yeah, that was one of my concerns, which is getting a good doctor. And so for this segment, I would share about my entire experience about finding a doctor, so that if anybody who's also on the same boat and also has like difficulties getting a doctor, I hope that this segment would help you think about what things are important to you when finding a doctor. So my first doctor actually recommended me to do lift, and the reason why he recommended me to do lift, because he predominantly does lift and fistulotomies for fistulas. So the thing is that since I cannot do fistulotomy, I'm only left with lift. And there's another surgery that he does, which is called flap, but he said that flap is left for like the more complicated cases, for people who had like multiple previous failed surgeries. And so he recommended lift in my case, and he also said that there will be no setons required and everything can be done in one surgery. So honestly, I really liked the idea of a one-stage surgery, because not gonna lie, I was really scared of getting a seton. And also he made the recovery process sound relatively simple and also quick, because he said most likely I could be back to my normal activities, or at the very least back to work by after a week, and also no packing required if like people had an abscess. So I felt like everything sounded really simple. However, at the time, I still wanted a second opinion, because this is surgery after all. And if you look up fistulas, there's actually multiple ways to treat a fistula. There's things like lift, flap, fistulotomy, fistulectomy, laser, and there's still so many that I don't even know about. But yeah, there are actually multiple ways, and I just wanted to make sure that lift was actually the best option for me, and so I went to get a second opinion. So for this doctor, we shall refer to him as the first doctor, and after that, this doctor that I'm going to see, we're going to refer to him as the second doctor. So upon another friend's recommendations, I went to see another doctor, and after clinically examining me, he felt that I didn't need surgery. And the reason why he said this is because he felt that the success rates for these kind of surgeries are very low. He mentioned that out of 10 people, 3 to 4 people would normally have to come back for a second procedure, which is basically the surgery failed and they have to do the procedure again. And he also felt like my symptoms weren't very serious, because at the time, I do not know why. That's why I say like my symptoms weren't very obvious. It's because when he was examining me, I suspect that I wasn't having a lot of swelling as well. So he felt that, you know, maybe I was healing and, you know, I'm not having like any swelling or anything, because he said that people who normally come for surgeries like this have been suffering for a very long time. They have been in significant amounts of pain, and so he felt like in my case, I don't really have to cross this bridge yet. I can afford to just wait and see. And so after going back from his appointment, I actually thought about it for a week, but I just felt like, yeah, the pain wasn't going away. I wouldn't say that my pain increased dramatically over the weeks that I was getting my opinions, but I would say that the pain was constantly there. It was a constant pain of 1 to 2 out of 10, and I just felt like I didn't want to live like this. Yes, I mean, it's not horrendously painful, but do I want to live every day constantly with a bit of pain? No, I mean, I'm a 20-something-year-old. I still have so many things to look forward to, and I definitely want to live my life pain-free if that is possible, and even if it takes hopefully not multiple surgeries to fix. And so I went for a third opinion. And at this point, you're probably wondering, why didn't I just go to the previous 2 doctors if I decided I want to do surgery? Well, I will explain more about that later, but I will just talk about what the third doctor recommended first. So the third doctor basically agreed with the first doctor in that I needed to do surgery, but what he recommended was a two-stage procedure, which is first putting aceton through my fistula tract. And what aceton is basically it's like a rubber band going through your tunnel. And the reason why people put in cetons is to actually allow infection to clear off, which is what my third doctor told the ceton was for. And after that, the second procedure would be laser to close off the tract. Laser is basically like there will be like a little probe or stylus that generates heat energy, and the heat energy is basically something that would actually close off the tract. I don't exactly know how it works because I'm not a medical professional, but this is how I would describe it in layman terms and how I understand it. And this doctor did the most type of surgeries because he does both lift and flap, which is what the first surgeon does as well. He also does fistulotomies, which is not applicable in my case, and he also does laser. And I guess at this point I should make it clear, so the first two doctors, the reason why I was also looking for other opinions is because they don't do laser, and that was something that I wanted to explore as well. The doctors, they don't do laser because they think that theoretically they don't see how it could work, but the thing is they don't do it. So I really wanted to consult a doctor that does laser as well to know what a doctor that also does laser would think about the success of the laser surgery. And ultimately he recommended me to do laser is because he's personally seen pretty good results with laser under the right conditions, and it's also the most simplest and least invasive method out of all the surgery methods to treat fistulas. And I also asked him why he wouldn't recommend lift in my case like the first doctor, and he explained that why he wouldn't recommend lift is because lift is a bit more complicated, and he felt like we should only attempt the more complicated procedures if we've already exhausted the more simpler surgery methods, and those simpler surgery methods fail. And after seeing the third doctor, I definitely had to make a choice on which doctor I wanted to do my surgery. And unfortunately, I realized the thing with looking for doctors is that it's really hard because it's not like buying things online. You know, you go Shopee, you go Lazada, you go any sort of online shopping platform, you would have reviews, you would have ratings to make your decisions on, but with a doctor, there's barely anything online. And so I found that entire process really hard. But after thinking it through, I've narrowed it down to two main factors that I look at when I chose my doctor, which is the first thing is skill, and the second thing would be my vibes with them. For skills, I think it's definitely hard to tell unless you have somebody who has had the same condition and had the same procedure with the same doctor. But for me, what I did was I basically just asked the doctor what is their experience doing this sort of surgeries. And even though they won't be able to tell you the exact number of surgeries that they did, normally by talking to them, I feel like you normally can tell and get a vibe and feel of how experienced they are when it comes to certain procedures. So for example, for my first doctor, I really felt like he was very experienced, especially when it came to fistula surgeries, and I can tell that he's very experienced with fistulotomy and lift. The second doctor, on the other hand, I didn't exactly ask him, but somehow during our conversation, I realized that he mentioned that he frequently only has to do fistulotomies and he rarely has to do lift. And in this case, even though I know that he's a very well-known colorectal surgeon and he's very experienced in this field, I just think he just wouldn't be the best doctor in my case to do my fistula surgery. For the third doctor, he also seemed really skilled, and I could tell that he was very confident with the laser surgery that he recommended. And based on this, I've narrowed down my choices to the first and third doctor. And for the second factor, which is vibes, what I mean by that is that whether you feel comfortable and confident for this person to be doing your surgery, for this person to be the one that you see for all of your follow-ups, and also the person that you would turn to if anything doesn't go well or doesn't go right. For the first doctor, I don't think there was anything bad about him per se, but I just felt like he was someone who didn't readily provide me information unless I asked the specific question. And since I'm not medically trained, I might not know everything I should be asking, and so I would rather want somebody who would explain things to me in detail, because I'm also somebody who really needs to know everything before I can be rest assured that I'm making the right decision. The third doctor was the one that I felt more secure and confident with, because right off the bat in the first consultation, he really did a very detailed checkup on my medical history, and he also physically examined me like in other areas other than just my bum area, because I'm not gonna lie, most doctors do just look at your bum. I know this is very TMI, but I just want you to know that there are doctors out there who will be very detailed, because in my case, he actually asked me like things like whether I smoke and whether I have a history of lots of mouth ulcers. He even like checked my stomach for any lumps or anything. And at this point, you'll probably think that isn't it very routine for a doctor to be doing all this, and you would be surprised that after seeing 4 to 5 specialists on this altogether, that not every doctor does this. And I think this was the only doctor that really took the time to understand my medical history and everything. And so yeah, he was the doctor that made me the most comfortable, and ultimately I decided to do surgery under him. And this really says a lot about how trusting the doctor is very important for me, because not gonna lie, I really didn't want to do a 2-stage procedure, because the idea of a ceton hanging out of me was just very scary in my opinion before I experienced it. But in the end, I still decided to go with this doctor's recommendation to do a 2-stage procedure, because he managed to instill confidence in me that this was a procedure that would benefit me the most. And so yeah, I hope this segment here helps somebody out there to decide which is a good doctor for them, because it really wasn't an easy process for me, and I really agonized about it for a really long time, because I think seeing these 3 doctors, it took me 3 to 4 weeks as well. So by the time I did surgery, it took me about 1.5 months from the time when my abscess first recurred up till the time that I did surgery. So right now, I'm 7 weeks out of the procedure where I inserted my ceton, and pain and discomfort is very minimal for me at the moment. Like even right now, I think I've been sitting on this chair for about 40 to 45 minutes just recording this video. And I would say that overall, my recovery process for this whole thing has been pretty smooth, even though there have been hiccups here and there. I would say that the first week was the most painful week, because I think that's when everything is very inflamed. And other than the ceton, I also had a Penrose drain inserted into me for an abscess that they found beside my fistula. So that caused quite a bit of pain as well. But I would say that by 2nd or 3rd week, the pain would improve a lot, and by the 4th week, I felt more or less pretty normal. I was able to sit down more comfortably, and also I was able to start taking walks as well. So right now, I'm waiting to do my 2nd procedure, which is doing the laser surgery. So what will happen in this surgery is that if the doctor finds that everything is all good and there's no remaining infection or pus or anything, he will just proceed to do the laser. However, he caveated this by saying that if he does find that there is still pus or there's still some infection ongoing, he will have to clear it up and also re-evaluate whether I need a thicker ceton. And so if that happens, I would have to wait for a 3rd procedure to get my laser done. In my case, the doctor is not recommending an MRI before this 2nd procedure, because actually what happened during my first procedure is that I did an MRI 3 weeks before my procedure, but the doctor was very surprised to find a really big abscess right beside my fistula, which didn't show up in the MRI. And so his suspicion is that maybe an MRI doesn't really pick up everything. And so he told me that it would be better to just let him do an examination under anesthesia, and if he felt like everything is okay, I can proceed to do laser. And so I agreed with it, because my thought process is just that it's great if I get to do laser, but even if I don't get to do laser, the doctor would have to go in to see what's going on to fix anything wrong. And that's why I agreed to just do this 2nd stage procedure. The doctor did explain to me that he can have a clearer picture of everything if he's able to just examine me in real time. But of course, I also just want to highlight that before recommending this examination under anesthesia, he actually already clinically examined me, and he felt like everything looked good from the outside, and also of course like pressed around my wound and felt like there was no remaining infection before recommending this. But what I would also like to point out is it's definitely important for you to ask your doctor if you have any doubts on the procedure. Like in my case, I did ask my doctor if it will be better to do an MRI before the 2nd surgery, and so that's why he explained this whole thing to me, and I was also in agreement with what he was recommending. So whenever in doubt, just ask your doctor so that you can make the best decision for yourself. So that's it for my fistula diagnosis and surgery story for now. I don't want to jinx it, but I actually feel really optimistic, and I hope that during next week, the doctor will decide that I'll be able to do laser, and after that, my only worry will be whether I recover well and whether the surgery is successful. But at the moment, I am truly quite happy with how things have turned out so far. I'll probably also make another video on care tips after fistula surgery, and also give an update on what happens next week. I also wish the best of luck and a smooth recovery to anybody who's also going through something like this right now, because I know sometimes it can feel very hopeless and recovery can sometimes be quite painful. But I hope by watching this video, you know that you're not alone and that you will recover sooner or later. That's all from me for today. Thank you so much for watching, and I'll see you on my next video. Bye!